14 years ago, when we just started thinking about Cure for the Kids, I can tell you, I always had this vision for a complete, comprehensive children's cancer center right here in Las Vegas. Did I think specifically about, yes, we're going to have education, we're going to do this? No, I just really went to work saying, as I identify the needs of this patient population, I'm going to figure out how to solve those problems. So on one hand, I knew that education is a big part of childhood. So therefore, if I'm going to be developing a center of excellence and having a region-wide, or a regionally recognized center of excellence, education was obviously going to have to be part of that. But 14 years ago, when we kind of were at the starting line of Cure for the Kids, I didn't know when it was going to be available. I can tell you, I'm actually very, very surprised with how much we've been able to accomplish in 14 years. I didn't necessarily think that we would have an education center in my tenure here. I have always hoped that that would be something that we could accomplish eventually. I'm just very, very pleased that we've been able to do it in such a short period of time. If I could wave my magic wand and look into the future for the education center here, I would say we would have a few full-time school teachers on our staff. We would have a really robust high school program, maybe distance learning or something like that, to where we can engage the teenagers, that 17, 18, junior, senior in high school. They're the ones who really fall through the cracks. At least that was my experience. And that's when they give up. And I really want to have a safety net here to help them see that if the traditional high school environment is not what's best for them, because of their medical situation, that there are other alternatives that they can gain access to so that they can still graduate from high school and hopefully go on to college. I'm hopeful that we'll have a scholarship program where we can help kids who have been treated here either gain access to vocational education or tuition assistance for traditional college. I don't want to say that a child with a complex medical situation can't go on and achieve the greatest of educational endeavors, and reach the highest levels of education. Oftentimes that's not the case based on, we know that we create cognitive impairment or chemo brain and different things like that when we give chemotherapy agents to cure the cancer. We do impact their ability to retain information and things like that. So, having a platform for them to jump off into a vocational and training environment, I think is really good, because one, our community is lacking that level of skilled worker, so that's something that we need to address as a community. But also, anything that can give these young adults the opportunity to be independent and the opportunity to feel that they're contributing regardless of what they went through, I think it's something really great to strive for.